Hi guys, it's been a minute since I posted a video. I had a discussion with my current cohort and I've had some requests about a video for medical terminology. There are a lot of nursing programs now that aren't really offering that, so you're kind of learning it on the fly, right? As you're going through other classes like med surg, and that makes it tough. So this is going to be a crash course or a boot camp, if you will, on the most common med term. Obviously, we can't do it all in a short amount of time, but I want to do the most common prefixes, suffixes, root words, stuff like that. So I'm going to share my screen. We're going to work from like a Word document, and I want to talk to you about the different medical terminology. So the key here is to break it down into smaller chunks, right? If you memorize the prefix, the suffix, the root word, stuff like that, I can give you something like, I don't know, supercalifragilisticexpialidocious, and you can break that into the smaller pieces and figure out what it is that, you're reading or your physician is saying or you're seeing in documentation in a way that you can explain it to your client, right? You are the expert now because you are the nurse. Your client doesn't understand what acute cholelithiasis is and the fact that they need a cholecystectomy. They think they're dying, guys. Okay, so we have to be able to break that down and explain it in a way that they understand. Okay, so that's kind of what we're going to work on doing today. So we'll go ahead and get started. This is your memorization piece, right? So we talk about you can't really memorize in nursing school. Well, there is some level of memorization, but you have to truly learn it. So start out by memorizing the prefixes, the suffixes, the root words, and then where your learning comes in is challenge yourself to put those different things together, right? So we're going to get started with one. So prefix is hyper, okay? Hyper is high. If you give your kids a high level of sugar, they have a high level of energy, right? So think about hyper as high. Most people, for instance, know what hypertension is, right? It's high blood pressure. It's chronic high blood pressure. But hyper is going to be high, okay? Just for learning, we're going to start with prefixes, but just for learning purposes, I want to give you a suffix. Let's do, um, how about, we'll do a root word, glice. Glice is sugar. Emia is blood condition or condition of the blood, either way, okay? Because when we get to IA, that means condition of, okay? So hyperglycemia, what are we looking at here? Condition of high sugar in the blood, right? Or blood condition of high sugar, okay? So the idea here, though, is to put as many terms together as you can. So we already did hypertension, right? High blood pressure. Hyperglycemia, condition or blood condition of high sugar. Hyperlipidemia, okay, so let's put those down. Hyperglycemia. Hyperglycemia. We know that this means high blood sugar. If you were to break it down, though, and that's how we want to do it, we want to start at that back side. Well, what is emia? A condition, a blood condition. We've got a blood condition of something, right? Blood condition. And then we can go back to the front and break those apart. Hyper, high, blood condition of high, sugar. Glycis, sugar, okay? So if we have hyperlipidemia, we have a blood condition again, right? Blood condition, because we've got that emia in here again, right? Emia, remember, is blood condition or condition of blood. Hyperlipidemia then is going to be a blood condition of something that's high again, because we've got hyper again, right? We've got hyper in here. So let's kind of highlight these. Hyper. Okay, here's your prefix, hyper. Hyper is going to be high. Okay, so high in this case in hyperglycemia, it's high sugar. Okay. In hyperlipidemia, what's lipid? Fat. Okay, so blood condition of high fat. This is high cholesterol, guys. Okay, because cholesterol is a fat. But that's your challenge. That's where the application piece comes in, right? We tell you guys all the time, you have to apply it. You guys can't just memorize stuff and forget it. You have lives in your hands, right? My program, the benchmark is 80%. You got to be 80% or above to complete the program successfully, okay? So, how do we get that 80%? It is not by memorizing. It is not by cramming the night before an exam. Will you do okay on that exam? Probably, but you're going to forget it all as soon as the exam's over. And we have to scaffold that learning. We're climbing these rungs, right? We have to build on it. Because when I talk to you about diabetes and med surg, we're going to talk about hyper and hypoglycemia. When I talk to you about cardiac disease, right, in med surg, we're going to talk about all the things that can happen if somebody has high cholesterol, okay? So you have to be able to build on that. And, we don't have time, as you know, to go back and teach things. And so this, again, is kind of your crash course or your review on your med terms. Okay. So let's jump back into prefixes. I want to start from the beginning. I just wanted to give you an example of that. This is a great place for flashcards, guys. Hyper on one side, high on the other, right? Glice on one side, sugar on the other. It's also kind of like putting a puzzle together. You got to be a detective. Maybe be fun with it. Draw out a jigsaw puzzle on a piece of paper. Put your terms in each little piece. Cut out your pieces and put those together. They interlock, right? And so you can make all of these different ones, but I want you to challenge yourself as we go through here. So, for instance, A, just the letter A by itself, right? Just the letter A means without, okay? We're without something. So, I'm going to throw some suffixes at you again just for a minute before we move on because I want to make an example. PNEA, guys, PNEA, breathing. Okay. Um, let's do, how about urea? URIA, urine. Okay. All right. So, and I want to change this to A or an. Okay. A or an. An is also without. So A or an means without. So everyone knows what asystole is, right? It's a flat line. But that means without, because A is without electrical activity in the heart. Okay, so that's your flat line. So if we go down here and put A in front of this, apnea, not breathing, right? Your client's not breathing because it means without breathing, but your client's not breathing. Okay. If we go down here, I want to add a suffix here, IC, ick, pertaining to. Okay. IC or AL means pertaining to. Okay, so if I say an uric, okay, pertaining to without urine, okay. So if your client is not producing urine, okay, so remember we start at the backside, so pertaining to, or you could say a condition of, okay, but pertaining to without. Or pertaining to without urine, right? I see pertaining to A without. We've got that urea in there. Now it's split up a little bit, but same thing. So without urine. So your client is not producing urine. Okay. So you've heard apnea before, sleep apnea. Those folks are not breathing in their sleep, right? And so we're putting these together. So AN is going to be without. We already did hyper. Hypo is low. Okay. Hypo is low. You got to come up with these ridiculous ways to remember things, right? So hyper, you give your kids high sugar, they have high energy, right? Hyper is high. Hypo and low rhymes, right? So hypo and low. And as I do this with you, I'm going to kind of stress these, okay? I'm going to say things like hyper or hypo because I want you to understand what it is that I'm saying, okay? So let's kind of stick with that high and low for a minute. Brady is going to be slow, okay? So Brady is slow. Bradycardia, we'll go back to that in a little bit. Tacky is going to be fast. So tachycardia, we'll go back to that in a little bit. We're going to do root words for body systems here in a minute, but I want to get through these prefixes, okay? It's important that you're understanding these because you can put these prefixes with anything, right? But I want to do these common prefixes, okay? So we've got hyper and hypo. We've got a or an, meaning without. We've got Brady and tacky, okay? Epi, above, okay? So if we say epi and add it to something like epigastric, above the stomach, okay? Epi is going to be above. Sub is going to be below. Now, hypo can also be below. You can say hypogastric to be below the stomach, low and below, but it still rhymes. It still rhymes, right? Epi above, sub below. Let's do some directions. Directions throw people off. Proximo, near. Okay. If something is proximal to, if you are proximal to the grocery store, it's closer to you. Okay. It doesn't take you as long to get there. Let's put a slash in there. Proximo, near. Okay. This is really referring to closer to the midline of the body, but sometimes you have to have a real world example, right? Closer to the midline of the body. Distal, so it'd be disto, but distal, okay? Distal is going to be farther away, and again from the midline of the body, okay? So my hand is going to be distal, and we're making comparisons here, right? Well, distal, well, yeah, your hand's out there, okay, but we're comparing it. My hand compared to my elbow, right? My hand will be distal, okay, from midline versus my elbow. If I'm comparing the two, my elbow is proximal to my midline, right? My elbow is closer to my midline than my hand is. Okay. So proximo and distal. Let's see. What else do we have for some prefixes? We've got high and low. We've got fast and slow. We've got above and below. How about a rith? Okay. Red. Okay. So if somebody has erythema, to the skin. They have redness to the skin. An erythrocyte is a red blood cell, so we can say eryth or erythro, either way, okay, is going to be red. Leuco is white, okay, like a white blood cell, okay. Melano or melano is really what it is, because a melanocyte would be a pigmented cell, right? So this is going to be black, darkly pigmented. A melanoma, okay. A melanoma is dark, okay. Let's see. What else do we have for prefixes? We can do some numbers. Bi is going to be 2. Di or diplo is going to be double, okay. And then, of course, you have the other ones, right? Is 1. Tri is 3. Quad is going to be 4. Okay. Poly, what's poly? Anybody know what poly is as you're listening to this? It's many, okay? Poly means many. So once we get past quad, I mean, we can keep going, but once you get past four, I would say that that's many, okay? So we would just move to poly. Poly is going to be many, okay? That's a lot of the big ones, guys, that I see a lot of the time. So I want to move in. Sometimes these root words or these combining words are also prefixes, okay? If I were to say cardiology, cardio looks like a prefix because it's the first part, but it's technically a root word. So here's what you can do. You can have a prefix and a suffix together. You can have a prefix and a root word. You can have a root word and a suffix, or you can have all three, okay? So it just kind of depends on what you're trying to do. So it just makes sense to me to move into root words from here because they look similar to prefixes, okay? So let's do some body systems. Let's go ahead and do cardio. Cardio is your heart. Most people know that, right? Cardio is your heart. Neuro. It's pretty self-explanatory. That's going to be your nervous system. Okay, nervous system. Now, we have a couple of things here. We can do musculo. Okay, musculo. Some body systems, some medical terms, if you want to say it that way, are going to have multiple things. So musculo and myo, guys, both are going to refer to muscle or the muscular system, okay? And I know it's musculoskeletal, but I want to break it down a little bit, okay? So musculo and myo, we're talking about muscle, okay? So if we say myo, like, so let's say we say myalgia. Algia, when we get to suffixes, is pain. That's the muscle aches that you get when you have the flu, but you see how we've put that in there. But musculo and myo are both going to be muscle. Similar to hemo and hemato are both going to refer to the blood. Okay? Hemo and hemato, blood. Okay? So if we begin with hemo, then we're talking about something in the blood, and we'll put some things together. We'll practice in a little bit and toward the end, okay? Let's see. How about veno and flebo? That's going to be vein. Arterio then is artery, and sometimes it makes sense, right? You can kind of figure it out. Now, that's not all the ways the case because let's look at this one. For a body part, freno is your diaphragm. Where does that come from, right? Veno, vein. Okay, great. Venous, intravenous, vein, that makes sense. But freno and diaphragm, it's kind of an odd one. But for the most part, it kind of makes sense, right? Skeletal, okay, is you're going to be your skeletal. Now, ortho is going to be your musculoskeletal system, okay? And that's why I wanted to break those apart like that. Ortho is your musculoskeletal system in general, right? So an orthopedic physician, right? That's what they're going to do. It's pertaining to because remember IC, right? And so that is going to be musculoskeletal. So um if you're talking about them together, typically that's what we're going to use is ortho, okay? Let's see, how about angio and vasculo? We're talking about your vessels, okay? Blood vessels. Let's put blood vessels. We're talking about blood vessels, or vasculature, okay? Spino or vertebro. Okay, spinal column, not spinal cord necessarily because we have vertebro in there and that's your vertebrae, so your spinal cord, or we can just say your spine. Okay. Cephalo refers to the head. This is gonna be goes with encephalo. Okay, so cephalo is head, encephalo is gonna be brain, guys. Okay. We have gastro, okay, or entero. I'm going to talk about that for a second, is going to be your digestive system. So gastro, digestive system. Gastro is your stomach, okay? If we break that down by itself, gastro is stomach. Entero is like your intestines, okay? So if you see a gastroenterologist, they're going to look at both things, stomach and intestines. And that's why gastro and entero is your digestive system, okay? Because they work so closely together. So if when you see your GI doc, right, that's your gastrointestinal doc, right? So it's a gastroenterologist, but they do mean separate things. Gastro is stomach, entero is intestines, okay? Respiratory can be pulmono and or pneumo, okay? Respiratory system, your lungs, right? Okay, for the most part. If you see a pulmonologist, you're seeing a doc that specializes in lungs, respiratory system, right? If you have pneumonia, it's a lung condition, okay? Reno and nephro is going to be your renal system, which are your kidneys, okay? So a nephrologist is a kidney doc, okay? And we're going to go back to that suffix. If you're in renal failure, you're in kidney failure, okay? We talked about uro, right? So if we say urology, okay? It's going to be your urinary system. Gyneco, female reproductive system. Andro, male reproductive system. Let's do acro. Acro with a C. And I'm doing this now because I want to make a point about spelling. Acro means extremities, guys. Okay, acro means extremities. So the reason I want to bring that up, well, why'd you go from male reproductive to extremities? Here's why. It's because of similarities in spellings, okay? It is very, very important, just in general and in medicine in general, that we spell things correctly, okay? When we start talking about medications, some medications are very similar. Couple of letters, one letter can throw everything off, okay? It is the same thing here when we're putting together medical terminology, okay? Now, andro and acro aren't too similar. But let's go back up to myo, right? I told you guys that myo is muscle, right? So I'm going to type that in again just so that you can see it. Myo is muscle, okay? Myelo, we add that EL in there, is bone marrow, okay? So just a couple of letters, and I'm really going to break your brain here in a second. But when we add this EL in here, guys, see this? EL, okay? It becomes bone marrow, okay? If we say myco with a C, myco, We're talking about fungus here, okay? So really different, really, really different, okay? And that is literally one letter, okay? And I'm going to give you another example here in a second. But myo, muscle, myelo, bone marrow, myco, fungus, okay? You see how similar these are, much more than acro and andro, but it just kind of makes sense to talk about similarities here, okay? Another big one is this, and we're still talking about body parts, right? We're out of systems a little bit. I think we've done them all. Cardiac, respiratory, neuro. We did the vasculature, we did urinary, renal, we did reproductive, we did GI. I think we've got everything for body systems, so we can continue on with body parts. If we say ilio, okay, I-L-I-O, I am actually going to bold that I and highlight it. Okay, because it's kind of hard to see with those letters. The I-L-I is hard to see. So let's highlight and bold. That I there, ilio with an I, guys, okay, is ilium. Okay. That's like your hips, right? That's in your hips. Okay. Let's do pelvis is pelvis. Okay. Ilium with an E, however. Okay. So ilio. Okay. So essentially the same thing, except for we've got an E here. Okay. So let's highlight this in a different color. I'll do blue again. Okay. This is your ileum. This is in your digestive tract, y'all. Okay. So very different. But do you see how one letter changes everything, right? Ileum with an I, we're talking about ortho, right? That's an ortho doc. If we say, I don't know, there's an injury there, okay? Ileum with an E, that's a GI doc. If we have an injury there, ortho docs are great. They're probably in my top three. I don't know. Does anybody else have favorite physicians? I do. But I love orthodox. I love ortho. Ortho's my jam. I did it for a long time. It's my favorite. I did ortho trauma in the OR, as most of you guys know. As great as they are, I don't necessarily want them working on my intestines, right? And I certainly don't want a GI doc trying to fix a fracture, okay? So it is really, really important, guys, that we are very strict about the way we are approaching things and the way we are spelling things, okay? Because truly that one letter can really make all the difference in the world, okay? So we've got a lot of prefixes here. I just want to kind of go through and take a look and make sure I didn't leave any big ones off. Guys, there's a whole medical dictionary with prefixes and combining forms. And as you go through body systems, that's where you're really going to dig into it, right? We've done a lot of big prefixes, but as you go into different things, when you talk about the digestive system, you're going to get different prefixes that maybe we didn't do here, right? But I'm trying to just give you these big ones here, okay? Prefixes and combining forms. We've got the body systems, we've done some body parts, we've done high and low, above and below, we've done the colors, we've done the numbers, we've done directions. I think that's pretty good. Let's move into some suffixes now, okay? So, how about did I put IA up here when we talked about condition of? That way, if you go back, I want you to be able to see it. Yeah, we did. IA condition of. We can also add osis on here. IA osis condition of. Okay. And if you know these, my go-to is always because I love my cats. I'll say I can give you guys hyper kitty cat osis. What does that mean? Condition of a lot of cats, right? Hyper is high. So, I mean, I can literally throw anything at you and you can break it down, okay? IAOSIS is going to be a condition of, okay? Let's do some, we'll start with some suffixes that can be a little bit confusing, like how about otomy or tomy is really what they do it, but otomy, okay? Surgical incision. Incision. Okay, this is an incision. Here is another case where one word changes everything. Okay. If we add an S in here, okay, so otomy, incision, okay, craniotomy, incision, oh, there's another prefix, crani, skull. Okay. See how that happens? You put things together, and sometimes you got to figure it out, and sometimes you can just by looking at it and taking the context of the word, try to figure out what that means. But crani skull, okay? So if we're doing a craniotomy with just a T, we're doing a surgical incision, okay? Or a tracheotomy. Tracheo is your trachea, colon. Okay. Because I'm going to use those here in a second. Okay. If we do a tracheotomy, okay, tracheotomy, surgical incision into the trachea. Okay. You see how those put together? Lock your puzzle pieces together, guys. Okay. Put those puzzle pieces together. Put your flashcards together. Trachea. Okay. Tomy or otomy, surgical incision, tracheotomy, surgical incision into the trachea. Okay. Stoma, stomy, ostomy, all we've done is we've added this S in right here. Okay. When we add that S in, we're talking about creation surgically of an opening. Okay. So a stoma, right? If somebody has a stoma. So if we do now a tracheostomy, we now have opening into trachea, okay? Colostomy, opening into colon, essentially. And so, but what that means is what? That we are pulling some of that colon out onto the abdomen, right? If somebody has a colostomy, right? Those of you that are STNAs or have been around medicine, you've seen that stoma. If somebody has a colostomy, they have an opening, right? And that's literally bowel on the outside, guys, okay? And then that's how we get the feces out, okay? We can do a urostomy. What's a urostomy? If somebody has a urostomy, what's that going to be? From the urinary system, right? Nephrostomy would be from the kidneys, okay? We can do that too to get the urine out. But do you see how close that is? Now, I will say this, you will in clinical practice often hear them used interchangeably. But when you are learning, you need to learn it from the basics, from the simplest way, right? So, otomy is an incision, guys. Now, here's the thing. Do we need an otomy to do an ostomy? Yeah, of course we do, right? Because an otomy is the incision, and then we're going to create the opening, but they're not exactly the same thing, okay? So be careful with that. I just wanted to point that out there, okay? Some of the suffixes, same as the prefixes, one little letter can change a lot of stuff, okay? Ectomy, guys, surgical removal, okay? Surgical removal. So let's go back up. Appendix. Got an extra letter in there. There we go. Appendix, okay? Um, Coli, gallbladder. Oh, and we did urology. We left cysto off. Cysto, bladder. You see how you think of other things? Here's another good example. Cyto, cell. You see how one letter, okay, so cysto with an S. You can't see that with that color. Let me change my highlight color. Cysto with an S is going to be bladder, okay? Cyto with no S is cell, right? I said earlier leukocyte, right? So leukocyte, let's put that down here. Leukocyte, what's a leukocyte? Put them together. Break it up right here, right? Break it up right here, okay? Leuko, and sometimes you have to do this, when you do this, write it down and think about it. Okay, well, I know that leuko is white, and I know that cyto is cell. Oh, okay, leukocyte is a white cell, which is a white blood cell. Okay. Erythrocyte is a red blood cell because erythro is red, right? Thrombo, clot. Thrombocyte, by definition, is a clotting cell. What's a clotting cell? A platelet. Okay. Thrombocyte is a platelet. Okay. So if I have to surgically remove my appendix, that would be an appendectomy. Surgical removal of appendix. Let's see what we've got going on here. Cholecystectomy. Okay. I told you chole was gallbladder. Technically, cholecysto would be gallbladder. So let's do that. Let's do chole as gall. Okay. Cholecystectomy would be surgical removal of gallbladder. And then I'll add, we've got that cysto because let's do another suffix and I'll illustrate why technically let's just stick with chole as gall. If we say lithiasis, well, let's do lith, stone, okay? Lith, L-I-T-H is stone, okay? So if we put something together like cholelithiasis, okay? Remember, break them apart. That IS, right? Or OSIS. Let's see, that IS, that OSIS typically is what condition, right? Condition of. Okay. Lith is stone. Holy, we're gonna go with gall. Okay. So what do you've got? Gallstones. This is gallstones. Okay. Or a condition of stones in the gallbladder, but they're housed in there. So, chole is gallbladder, right? But, if we're breaking it down, cysto, bladder, gall, it would, or chole gall, we're breaking that up. But we don't say cholecystolithiasis, okay? We say cholelithiasis. Those are going to be gallstones, okay? Condition of gallstones, but where are those stones going to be in the gallbladder? Now, they could be in the little ducts around the gallbladder too, but typically they're in the gallbladder, okay? Let's see. What else do we have for suffixes that I want to do with you guys? Oma. Oma, abnormal growth or a tumor. Okay. Let's add another, and I briefly brought it up at the beginning. Let's add another prefix, lipo, fat. Okay. So if we have a lipoma, it's literally a fat tumor. If you watch Dr. Pimple Popper, she surgically removes a lot of those, right? They can be pretty big size. So literally just a tumor made of fat, y'all. Okay. Liposuction, we're sucking the fat out, right? We had talked about hyperlipidemia, right? Which is high levels of fat in the blood or high cholesterol. Okay. So lipoma is going to be a fat tumor. We've got that lipo when we're putting it together with oma. Stasis, stopping. Okay. So hemostasis. Go back up. We said hemo or hemato was blood, so we're stopping the bleeding, right? Bacterio, obviously bacteria, okay? Bacteriostasis, slowing or stopping the growth of bacteria, okay? Because we're slowing something down or we're stopping it, okay? So hemostasis is a good thing, okay? When we're trying to get a wound to stop bleeding, when we're trying to get someone to clot, we want that hemostasis. That's the whole point of blood clotting in the body is to stop that bleeding, right? Cytal killing, bactericidal killing bacteria. Okay. So what's bactericidal? Antibiotics, right? There's a good prefix, anti against. Okay. Antibiotics would be against microbes, okay? Against that bacteria. You take an antibiotic to kill that bacteria, whatever it is, right? You take an antifungal to kill that fungus, okay, whatever it is. And so anti then is going to be against. If you give someone an anticoagulant, so coagulo, clotting, or coagulation, right? Coagulation, which is clotting. Anticoagulant against clotting. Okay. Now, we're not stopping the clotting completely, right? That would be bad. We'd never reach hemostasis. We'd have a problem, right? But we want to slow the clotting down for whatever reason. Maybe they have a history of a stroke. Maybe they have atrial fibrillation, right? And we don't want them to clot as much as fast, okay? Did we do thrombo? Thrombo is going to be a clot. Well, thrombus is a clot, right? But thrombo is clotting, okay? So if we have thrombosis, right? Thrombosis, condition of clotting, okay? But a thrombus is a clot. So let's say thrombo is clotting. A thrombus is a clot. Thrombosis is a condition of clotting. Embolo, it's a foreign body, we'll say. Similar to a clot, but when we're talking about thrombo, when we're talking about thrombus, we're talking about a blood clot, okay? Remember thrombocyte. This can be an embolus, okay? Can be really anything, okay? It can be a clot that breaks free. So if you have a DVT, if you have a clot like in your lower leg and it breaks free and it travels to your lungs, for instance, okay? If it's traveling, it's an embolus, but we can have, so it can be a blood clot, but it can also be fat, a fat embolus, okay? It can be amniotic fluid. It can be air, okay? Anything that's not supposed to be in that blood vessel, okay? An embolism is now a condition, okay? It's a condition of an embolus, essentially, okay? Condition of embolus, okay? So if you have a pulmonary embolism, which typically it's usually a clot, but you could have an amniotic fluid one that goes to your lungs, right? Or an air one that goes to your lungs. This is gonna be that foreign body or that clot that has now lodged in the lungs. Okay. That's bad news, right? We don't like that. We don't like a pulmonary embolus. We don't like a pulmonary embolism. Okay. That is bad news. Okay. Let me think for a second and see if I got the main ones. Now you see, as I start talking through things, I think of more things, right? And that's kind of how it's going to work. And I want you really to practice and go through synthesis, withdrawing fluid. Oh, here's a good one, arthro, joint. Okay, arthro, joint. So an arthrocentesis then would be withdrawing fluid from a joint. Okay. Another surgical one, plasty, surgical repair. Okay. So if we do an arthroplasty, surgical repair of a joint, could be a joint replacement, right? What's rhino? Rhino is your nose. Think about a rhino horn, right? Rhino is your nose. Okay. So a rhinoplasty then would be surgical repair of the nose or nose job. Okay. Now we can surgically repair it. Say somebody gets a broken nose, we need to go in and repair it. By the letter of the law or the nature of the suffix plasty, it's surgical repair. But to folks that feel like they need a nose job, even if it's elective cosmetic, they feel like their nose is being repaired. Okay, so that would be a rhinoplasty. Okay, blepharo is eyelid. So a blepharoplasty would be surgical repair of the eyelid. Okay. Sometimes if people are gonna have like an eyebrow lift or something, that could be called referred to as a blepharoplasty. Okay. But blepharo is going to be eyelid. Okay. A big suffix is itis, inflammation. Okay. You could put all kinds of stuff together, right? Blepharitis, inflammation of the eyelid. Arthritis, inflammation of the joints, okay? Osteoarthritis, that's your wear and tear because remember, when you get into med surg, remember there's going to be rheumatoid arthritis and osteoarthritis, right? Rheumatoid arthritis is an autoimmune disorder. It's different from osteoarthritis. Osteoarthritis is going to be the wear and tear arthritis, and it's going to involve the bones in the joint as well. So osteobone, arth, joint, itis, inflammation, right? So osteoarthritis, osteobone, arth, joint, itis, inflammation. Inflammation of the bone and joint. Okay? But itis can go with anything. That's going to be any kind of inflammation anywhere. And there's tons of different stuff. Phlebitis, inflammation of the vein. Okay. Appendicitis, inflammation of the appendix. That's why we would do an appendectomy, okay, to take that appendix out because it's inflamed, okay. It's very painful, which would be algia, pain, okay. You can also have a prefix for that, which would be dys, and this would be difficult, bad, painful, okay. Any one of those things. So if we go way back to the beginning, dyspnea, difficulty breathing. Okay. But it could also mean painful, right? So if you have dysuria, that could be difficulty urinating, but it could also be painful urination. Like if somebody has a UTI, difficult or painful urination, okay? Difficult or painful urination. If somebody has a UTI, it's probably both, right? Because what happens when you have a UTI, it burns, right? And sometimes it's also difficult kind of to start that stream. And really, if it's painful, it's difficult at the same time. So that can be difficult or painful urination. And just keep in mind that DYS can be difficult, bad, painful, okay? So I want to talk about a couple of suffixes, and I think we're about done because I could seriously, guys, I could go on all day, but I just want to do the big ones. But these are commonly confused as well. Okay, phasia with an S, phasia with a G. Okay, again, remember that one letter, guys. You see how one letter again changes everything? So S, here's how I'll tell you how I remembered it. Okay, here's how I remembered it. S for speech. Okay. So phasia with an S is speech. So if someone has dysphagia, it would be difficulty forming speech or difficulty speaking. Okay. But it's speech itself. It doesn't have anything to do with sound, guys. Phonia is sound, okay? So if someone had dysphonia, that would be difficulty producing sound, not difficulty producing speech. It is not the same thing, okay? We produce speech in lobes of our brain, right? So maybe after someone has a stroke, they have difficulty finding the right word, okay? But they can still make sound. So that is not the same thing, okay? So dysphagia, difficulty forming speech, difficulty speaking. Aphasia, inability to form speech. Remember, a means without, right? There are different things, global and expressive aphasia, that's more of a receptive aphasia. There's three different ones. That's more of a med-surg concept, but they all refer to speech, okay? So dysphagia, difficulty, aphasia, you just can't do it in some type of way, depending on the type of aphasia that person has. Phasia with a G, on the other hand, okay, let's highlight in a different color. Phasia with a G, G for gut. This is swallowing. When you swallow, it goes to your gut, right? You guys love my corny, terrible jokes, but you remember stuff, right? G for gut means swallowing. So phasia is swallowing, guys, with a G. So dysphagia with a G, okay, is gonna be difficulty swallowing, okay? So again, now when you're saying this out loud, right? Dysphagia, like it sounds the same, right? So sometimes when I'm teaching, I might say dysphagia versus dysphagia, okay, but there's still phasia. I just do it for teaching learning purposes, okay? So you might have to say dysphagia with an S, right? Dysphagia with a G. So when you're saying it out loud so that folks understand, but when you're writing it, then obviously you see the letters. But do you see if you spell it incorrectly, it's going to be completely different. So if your client comes in and they have difficulty swallowing, they're just like, man, nurse, whoever, every time I try to swallow, I feel like I'm choking. Okay, all right, well, we've got dysphagia, difficulty swallowing. If you say, let's say you write that down and you're rushing and you write it down with an S, and this is the first time your doc is seeing your patient, right? You're at an outpatient clinic, and your doc looks down and sees dysphagia with an S. They're going to think, oh, difficulty speaking. Is that going to change their entire approach? Abso-freaking-lutely, right? Because they're going to want to know, well, what's the difficulty with speech? And they may change the way they approach their patient, right? Depending on the type of dysphagia that they have. So we'll go into that a little bit. Expressive aphasia is difficulty expressing themselves, okay? So they understand what you're saying, they just can't find the right words. If you ask them what time it is, they might say pencil, okay? So expressive cannot express correctly, okay? Receptive, they don't receive, so they don't understand what you're saying. So if you say, what time is it? They might think that, either they don't understand you at all or they think, you asked them what's your dog's name or something, okay? Global would be both. But if you write down dysphagia with an S instead of a G, your doc's gonna go here, right? And so they're gonna change their whole approach. And until they start talking to their patient, which may be different, and the patient's going to be like, what is going on with this physician, right? Because the physician thinks they're having an issue with speech, okay? And so it changes their approach, and then until they get down and realize what it is, they're kind of pre-forming almost this diagnosis, right? These two things are going to be treated differently, guys, okay? So it's really important that you're spelling. So, when you're doing your flashcards, I really, really very much so encourage you to copy it down just right from the book, right? And make sure you're getting that spelling correctly. Not that I don't think you guys can spell, but that spelling sometimes can be really tricky, that one letter, right? Mayo and Myco, the two different idioms, okay? So make sure that you're getting that correct on your flashcards, and spelling's going to be a part of it. So practice writing these out, right? And that's kind of why I did this here, right? Practice writing these out. So I'm going to scroll up to the top because I'm about done. Because like I said, I could go all day with this. And I'm gonna let you kind of, if you want to screenshot or take pictures of these different things, okay, and then I'll move down. So we've got hyper down to Arturo. But keep in mind that spelling is going to be very important, and that's why I wanted to do it on a page so that you could see it. So when you're doing your flashcards, guys, pay attention to the spelling. Say them out loud. Guys, pronunciation matters, okay? It does. Are you going to be able to pronounce these perfectly right away? No. Okay, no, of course not. Some people still can't do it, okay? So I'm going to scroll down a little bit. We're going to go Freno down to Craney, okay? So make sure that you're practicing the pronunciation. Say them out loud to yourself. Listen to people, right? Listen to the way things are pronounced. Get on, some kind of, translation app or something, right? Pronunciation app so that you can pronounce these the correct way here, okay? Let's go tracheo down to lipoma. Make sure you're writing them out and practicing your spelling. And don't just write them out, guys, because you could write it out and not catch the misspelling. Okay, when you write it out, go back and look it up. Get yourself a medical dictionary, truly. Okay, there are medical terminology flashcards that you can get as well that you can like purchase commercially. That's something you can do so that you can check your spelling. But I definitely recommend doing something along those lines to make sure that your spelling is correct, okay? Because again, it makes a difference, okay? And then there's the last little bit. Hopefully that helped, guys. If you need anything, please reach out. Um, Very basic, very crash course. There are so many different prefixes, suffixes, root words, but practice putting these together. If you come across a word you don't recognize, look it up, okay? Don't just kind of gloss over it. I'll leave you with one last one. Epistaxis. Epistaxis is a nosebleed, okay? I cannot tell you how many students I've had see this word on an exam and say, I don't know what that question was asking me. It's I don't know even what that word is. Oh, well, that's epistaxis, okay? Or atelectasis, that's another one. Atelectasis, people have a hard time pronouncing that. Well, I don't know what that is, right? Okay. So if the question says Mr. Jones is suffering from epistaxis, what is the nurse's intervention? You don't know what epistaxis is, you can't answer that question, right? So you're literally just playing the guessing game, okay? If I were to say to you, though, Mr. Jones has a nosebleed, what's the nurse's intervention? You go, oh, okay, we're going to lean him forward, we're going to push on the bridge of the nose and hold pressure, right? We're going to stop that bleeding. And all the students say, oh, well, if I would have known what epistaxis was, I could have answered that question. Yeah, exactly, right? Epistaxis was in your reading. Did you look up that word when you came across it? No, I didn't understand it. I moved on. Okay, well, and then you missed that question on your exam, right? It's your journey, guys, okay? But if you come across a word you don't understand, look it up. If you're doing your reading, and y'all gotta get in the book, you do. If you're doing your reading and you come across epistaxis and you look it up, you're the one that gets that answer correct on the exam. Okay, so seriously, you guys, please, please, please look up those words, right? So work on your medical terminology sooner rather than later. It will help you when you get into the med surge stuff, okay? And I hope that was helpful. Again, if you need anything, please, please, please let me know. I will see you guys for the next one.